Good morning. I feel very grateful to have this opportunity to highlight a nicotine cessation program, which is offered through our UT system, which reflects our site in Dallas, as well as our other sites, which are up in Fort Worth and in Richardson, which provide a comprehensive free program that our patient base, staff, as well as our community can access. It replicates many of the gold standard programs which are offered through the country to really hone in and focus and understand that individuals who are using nicotine in any manner at all, if it's through cigarettes, if it's through tar-based products, as well as now the current wave of vaping, that we appreciate that once they become attached or addicted, they really do require high level of support to allow them to move toward a healthier lifestyle. With that said, we have the privilege to utilize funding we've gained through our Comprehensive Cancer Center status, and it's within our community outreach programming that again allows us to do a reach to our patients, our staff, and to our community. The way we do roll out our program is looking at best outcomes for success, which have been demonstrated through the country, which involve a three-pronged approach. The first and foremost, which will always be viewed as the most valuable, is that provider-initiated conversation with their patient. If you as the provider can get the attention of an individual struggling with this, that is what they will remember more than they will come across reading, through the media, or through friend or family. So once gain their attention through that way, what we also do know is, as that second prong, is to provide them the option of any pharmaceutical support which would help them in their endeavor. Nicotine replacement is one that's most known, and that is something that a patient on their own could achieve, could acquire. But then too, other pharmaceuticals have come forward which are beneficial, which include Chantix, Wellbutrin, as well as any other anti-anxiety agents. Last but not least, in that third prong, which is where we step in, is really working and helping folks offering education and support programming. Now for that, programming itself, people can access it through a few ways. If you have access through an EMR, best practice alert, a referral can be made very simply that way. Then we will take the next step, we will contact the individual. We also have the privilege of working with low-dose CT lung cancer screening counterparts here on campus and within Dallas. Our hope and effort is that we can cross-identify individuals who will benefit from both to optimize their care toward a healthier lifestyle. As well, people can self-refer. They can do that through our online presence, through email, or through telephone. What I do want to mention is, as a provider, if you choose to dialogue with your patient about this, there is recognition monetarily where you can bill for it, and that's through CPT codes. There are various levels based on how much time is either needed or appropriate or available, where you can recognize that and at least receive some recognition to start that conversation. Now, once they enter our program, the services which we offer, and again this replicates other gold standard programs throughout the country, is we offer a weekly group. Again, these are all free. We also offer one-on-one private appointments where some individuals really want more discretion. They feel that they can bond better with one of our educators. So again, that's made available. For those who want to try to spend more time with us, but it's inconvenient with their busy lives, we also have telephone appointments which we make available. If needed, a patient can also access our provider clinic for pharmaceutical choices if you, as the provider, choose your patient to come in that pathway. We have been exploring telenicotine, and that tends to work for sites which they really want to own their own patient base. They want to have complete understanding what their patients are going through, so we can telenicotine in to your clinic area and provide these educational programs. Our services currently do target the outpatient population. We are moving toward a phase 2 where we're going to begin working more closely with our inpatients through a consult service. For our team itself, we're all certified through the American Lung Association, the American Cancer Society, and also we're active members in the University of Texas system Eliminate Tobacco Use, and we have a presence on their various committees, which include policy, prevention, education, and cessation. For our more global prevention services themselves, we will do a reach into communities, be it school systems, colleges, businesses, corporations, the school systems, where we'll provide a speaker free of charge to go in and give a very generic overview of education and awareness of this theme. With that, we also accept that the younger the population we can reach, we hope that it'll have a greater impact to prevent tobacco use. Understanding how highly addictive it is, we really urge individuals to just not even try it, because a great percentage of those will become addicted, and then fast forward to 30, 40 years later, they are then at high risk for some of the things Dr. Brewington has mentioned. We also have an online education offering, as well as going out into the community with our outreach events. What I do want to mention as a provider, if you have a patient or a patient just lost a loved one from lung cancer, or it may be your neighbor who has any involvement at all within school districts, school systems, it could be the PTA mom, it could be the principal of the school. Those are wonderful, wonderful access points to mention. The critical need for any type of nicotine prevention, abstinence from it, because there will be children who will try it once and become addicted very quickly. And often what we've learned is the vaping then moves to other tobacco products, sports especially, baseball. Baseball uses a lot of chew tobacco. That's a very heavy tar hit in parts of your body that will damage over time. So just please remain highly aware of where and how individuals become addicted, because as daunting a task as that is to speak to a 16-year-old who's already addicted, it magnifies tremendously when you're speaking to the 60-year-old who is heavily addicted and facing a health crisis. I do want to mention within the state of Texas, as other states also offer, there are resources dedicated toward this cause. There is a Texas Quick Line. It's available 24/7. It is free. And for the patients in need, they do have access to a limited supply of nicotine replacement therapies. Local American Cancer Societies and local American Lung Associations also have various offerings which are worth exploring. Through contacting them, I believe they are successful resources to either say, yes, we have this right here, or yes, there's a local provider in our area which offers this, and if they don't, most likely they will know which facility in your closest proximity would be appropriate for you to try to create a partnership with. But I find them invaluable in being highly aware of which resources exist within the country. For any further questions, please feel free to contact us either through phone, through email, for anything which you yourself as a provider or which you feel your patients may gain benefit from. Please do reach us. Thank you.